and welcome to Heard at Health. I'm with Bob Booth, Chief Care Officer with TimelyMD, a health and well-being company targeting students in higher educational institutions. So Bob, I love the name of your company. So much about healthcare is timely intervention, and perhaps nowhere more so than in mental health epidemic that we're facing. So what are the benefits of facilitating good mental health at the college level?
Well, thank you for this opportunity to chat with you. And as you mentioned, TimelyMD is the leading solution for student-focused virtual mental health and physical well-being. The key benefit is that students do better towards accomplishing their goals when they have support. So we just surveyed students in August and found that compared to their mental health in 2021, so just 1 year earlier, 86% of students said that their mental health was as bad as it was the year before or even worse.
Wow.
And we know that students cite that mental health is the #1 stressor for why they leave school. So to us, it's the difference between a student reaching their goals or not reaching their goals.
Right. You know, so much of telehealth utilization has kind of dropped off since the pandemic severity has reduced. Is that true of student populations too?
No, it's actually the exact opposite. So even as COVID leaves the headlines, mental health is still the #1 thing on students' minds. 9 out of 10 students tell us that there's a mental health crisis on campus. And as mentioned before, it's the #1 reason they leave. So we're incredibly proud of the fact that we can reach students, of which we serve 1.5 million across 250 schools, and give them timely access to care. So if you go out into the community, we're seeing wait times between 4 weeks and 10 weeks. It's 4 minutes for us to connect a student to care. And students are responding really well. We found that 75% of students see an improvement in their mental health care after meeting with us. And that number is 100% for our high-risk students who are identifying suicide as a risk factor. So to us, that's incredibly important. And we have anecdotal stories of students who are showing up having attempted suicide weeks before arriving on campus. We can't afford for those students to wait for care.
Now, when we think of mental health access, we think of access to psychiatrists and counselors, but I'm wondering what you think of peer support and how important that is.
It's incredibly important. We need a full ecosystem of care. If there is a silver lining of the last couple of years, it's been that it's normalized the ability for students to talk about their mental health. And when we asked them what they wanted from us, the #1 thing they asked for was the ability to be able to engage with peers on mental health, which is why we built a peer-to-peer platform for students. It's been incredible. It's driving engagements in ways that even surpass what we expected. We're on pace just in the fall semester, so August to December, we're on pace for 500,000 engagements across our live and our peer-driven platform. And it makes sense. I think there's an inertia to care. It's not enough just to provide access to care. There are still people who are wanting to get help, but they don't know if their issues are big enough yet to go to a professional. And so they do what we all do. They want to ask a friend. They want to talk to a friend about what's going on. I think it's really important for us to remember that even though there is a crisis going on, students are very resilient. And this gives an opportunity for them to share out of that resiliency and help each other. So to be able to solve this, we need help from everyone.
Well, good luck with your efforts. Truly, students need all the help they can given the last few years and the experience that we all shared, but especially young kids and kids going to college. So thank you so much, Bob,
Thank you
for spending the time with MedCity today.
Thank you very much.